Good afternoon, everyone. We're going to get started. Everybody enjoy your lunch? Pretty delicious? Okay. So I get the pleasure of introducing our next speaker. And before I do, I want to remind you all to complete your surveys by the end of the day to give us feedback or evaluations. Okay. So this session is called Optimal Age of Gonadectomy in Dogs and Cats. And we have Dr. G. Robert Weedon back with us. He is a high-quality, high-volume spay and neuter surgeon and a former faculty member at the University of Illinois College of Veterinary Medicine. He has trained veterinarians nationwide and is a leading advocate for addressing pet overpopulation, particularly in community cats. His work spans clinical practice, education, and global animal health initiatives. And with that, I'd like to welcome Dr. Weedon.
I've got a cheering section back there. Okay, I had two criteria for presenting, and neither one of them was met. I won't mention any names, but her initials are Sherry Storms. I don't like to present right after lunch for obvious reasons. I mean, I'm ready for a nap. I don't know about you guys. I also don't like to present after Trish McMillan because she does such a good job that it's a hard act to follow. But thank you for being here. This is a controversial topic currently, one that I'm interested in, primarily because of my interest in community cat management. My professional life has been devoted to animal population control. And as we get into this presentation, you'll see that there are some now that are questioning the relevance of animal population control. I guess one of the things I hadn't planned to do, but I should do, and I want to leave plenty of time for Q&A at the end. We had those of you that were here for the public health benefits of TNVR programs, we had a really great, robust Q&A session. And I suspect, given this topic and how controversial it is becoming, that we'll probably have the same robust Q&A session. So I'm going to try to leave some time. But one of the things I need to do, I guess, and I hadn't thought about this, is define the term gonadectomy. I was talking with someone earlier this morning, and she asked me, what does gonadectomy mean? And I'm actually going to define, spaying and neutering in the presentation, but I really never thought I needed to define gonadectomy. And I told the story when I was in vet school at Purdue, many years ago. It says my battery is running low. I might want to plug into PC. Well, while she's playing, I don't know. If the presentation goes out, I'll just do those little hand things, But so. When I was in vet school, we had an intramural team, and we named ourselves the Nads, and they would cheer, "Go Nads, go Nads." So a gonad is a reproductive structure, either an ovary or a testicle. They produce either the egg or the sperm. It went away, so evidently it's working now. So the term gonadectomy is kind of a broad term for removing the reproductive organs, either the ovary or the testicle. And we'll further define that as we go along. But the goal of today is to talk about the best timing for gonadectomy based on current research. And some of that research is controversial, and some of it's actually a little contradictory. So I think that that I want to start out by kind of framing this from the perspective of why do we sterilize animals? And the three most common answers that I get and that I've heard and seen is some people believe they are healthier, others believe that they behave better, and obviously, at least for me, to prevent reproduction. So I'd like for you to keep this question in mind as we go through the presentation. So here's just a quick overview of our agenda. I'm going to talk about gonadectomy, and I'll define, spaying and neutering and all that stuff. We're going to talk about, what's all the fuss about, and talk about health benefits and risks, factors influencing optimal age for gonadectomy. Scientific evidence, as I said, is somewhat controversial and even contradictory, and current recommendations. And then I'm going to finish up with the world according to Bob, practical implications for veterinarians and pet owners. Now, before I get started, it's really important to me that you understand that I'm not going to tell you what to think. I just want you to think about this issue. All right, so I already kind of defined gonadectomy, but it's one of the most common surgical procedures performed in dogs and cats worldwide. Estimates indicate that over 80% of companion animals in North America undergo spaying or neutering. Practices vary by region, with early age gonadectomy, as young as 8 weeks of age, common in shelters to reduce overpopulation. So keep that in mind, as we're framing this and the original question I asked you, reduce overpopulation. While some private practices will delay surgery until later developmental stages. Spaying involves removal of the ovaries and uterus to prevent reproduction in female animals. Although there are variations on that theme. Now, some veterinarians are advocating for ovariectomy, just removing the ovaries, rather than ovariohysterectomy, meaning removing the ovaries and the uterus. Let's muddy the water even more. There's a small but vocal faction that are now advocating for ovary-sparing hysterectomy in dogs and cats, where the uterus is removed, but the ovaries remain in order to maintain normal hormone production. While neutering is a kind of a generic term meaning an animal made sterile by castration or spaying, the most common use is to denote castration, i.e. removal of the testicles of a male. Both procedures reduce hormonal production and lower risks of certain cancers and infections. Pediatric sterilization, which is usually performed between 2 and 6 months of age, is routinely performed by shelters and rescues. Techniques in anesthesia vary based on the animal's age, size, and health status. Pediatric sterilization is very quick. Those of you who are involved with pediatric sterilization know that the patients recover rapidly, and it has been proven safe and effective. High-quality, high-volume spay-neuter, the acronym HQHVSN, these clinics are specialized veterinary operations designed to sterilize large numbers of dogs and cats efficiently while maintaining high standards of care. And those of you that were in my earlier session, I mentioned that the acronym HQHVSN, high quality comes before high volume. And studies have shown that outcomes are better in these types of settings, and that is mirrored in the human literature, where surgeons who do the same procedure over and over become very proficient, and the complication rate is actually lower. And I recall when I first started doing spay-neuter, gosh, this was back in the early 90s, their veterinarians were criticizing high-quality, high-volume spay-neuter surgeons, saying, "Oh, they're cutting corners. They're you know, they do it cheaply to do more during the course of a day," and that is not the case. High-quality, high-volume spay-neuter is not cutting corners. We use protocols. Everything's protocol-driven. The same person does the same thing over and over again, and they become very proficient at it. We use streamlined workflows, specialized techniques, expertly trained staff, and we perform 30 to 60 surgeries a day, aiding in pet population management. Although ovariohysterectomy is generally considered to be safe, one study found that the odds of any type of complication occurring with elective OVH increased by an estimated 2% with each additional minute of anesthesia time, highlighting the importance of efficiency and decreased surgical time. Now think about that for a minute. If a high-quality, high-volume spay-neuter practice spays a dog, for instance, and it takes them 10 minutes, whereas somebody who may do 1 or 2 a week, it takes them longer, 20 minutes or 30 minutes, that additional 10 to 20 minutes has the potential to increase the complication rate by 20 to 30%. And so this is all about efficiency. So what's all the fuss about? You know, spaying and castrating dogs and cats has been considered for decades to be a routine standard of practice in veterinary medicine, at least in the U.S., for the prevention of numerous undesirable behaviors, medical conditions, and diseases. Additionally, and perhaps more importantly, the procedures have been promoted as a method of curbing the severe pet overpopulation problem in the U.S. Recently, however, this routine practice has come under scrutiny and become a very controversial topic. The general wisdom and safety of the procedures have been questioned by those who are concerned that the procedures have some unintended consequences that are only recently being recognized. A few decades ago, it became standard practice in veterinary medicine to neuter dogs at 6 months of age. And I was asked by someone not long ago, you know, why did we establish that 6 months of age rule, I guess, or standard? And I graduated from veterinary school probably before many of you were born. And back then, a lot of practitioners did mixed animal work. And most of them, at the time anyway, were male. And because they did large animals, they were usually larger males and had, I remember the first guy I worked for had these big meat hook hands, and he needed a big incision to get in the abdomen to get the uterus out with his big meat hook finger. Well, somewhere along the line, somebody invented the spay hook, which made it a lot easier, but it kind of settled on 6 months. Now, I also recall veterinarians telling people that, you know, a dog should have a litter before they're spayed, or they should at least have a heat cycle. And I think that goes hand in hand with using that big meat hook finger to find the uterus. But so the standard for a long time was 6 months of age. Well, you know, there's been emerging research that suggests that while spaying and neutering reduces reproductive cancers, it can lead to long-term health issues by removing protective effects of hormones. And some of the key risks that we're going to talk about today include the incidence of certain types of cancers, notably osteosarcoma and hemangiosarcoma, joint disorders, hip dysplasia and cranial cruciate ligament tears, obesity, and behavioral changes like fear or aggression, particularly in large or early neutered dogs. So it all started with some research out of the University of California, Davis College of Veterinary Medicine, when in 2013, Hart et al. Published an article entitled "Neutering Dogs: Effects on Joint Disorders and Cancers in Golden Retrievers," calling into questions the benefits of pediatric sterilization. This was followed in 2014 by another article, "Long-Term Health Effects of Neutering Dogs, Comparisons of Labrador Retrievers with Golden Retrievers." You see a trend here, where they posed that Labrador Retrievers neutering at less than 6 months of age doubled the incidence of one or more joint disorders in both sexes, and that Golden Retrievers, quote, with the same 5% rate of joint disorders in intact dogs, neutering at less than 6 months of age increased the incidence of a joint disorder to 4 to 5 times that of intact dogs. These studies turned the veterinary community upside down as people were extrapolating this research, done in 2 breeds, to the dog population as a whole. So, fast forward to 2020, when the same group took it one step further and published an article entitled "Assisting Decision-Making on Age of Neutering for 35 Breeds of Dogs." All right, where'd my mouse go? Uh-oh. Oops. In this article, they listed, I have some statistics that I wanted to quote, but I can't find them. Oh, well, okay, so they listed different breeds of dogs, and to their credit, and I know this is really hard to see, but the vast majority of breeds, they said it was the owner's choice or the veterinarian's choice. But for me, oops, something's not right. Okay, yeah, there you go. Now you can see it. Inexplicably to me, they recommended that male Doberman Pinschers and female Golden Retrievers not be sterilized. And I certainly did not understand that, and to this day I don't understand it. Then along came this recent paper in the Journal of Small Animal Practice that concluded that the evidence that gonadectomy influences the development of a condition is often conflicting, and it varies depending on the breed, sex, and condition of the animal. More importantly, they concluded that, quote, available data does not support a decision to stop spaying and neutering for all breeds of dogs. For many breeds, there is still no available information, and even for those which odds ratios or relative risk for specific diseases are available, the initial risk in the intact population is generally so low that its doubling or any further increase may not raise any concern. The most damaging, and in my humble opinion, misguided publication to come out was the WASAVA Guidelines for the Control of Reproduction in Dogs and Cats, published in the Journal of Small Animal Practice in 2024. For me, some of the recommendations were so bizarre as to be beyond belief. For instance, there's undue emphasis on novel techniques to preserve gonadal hormones, such as ovary-sparing hysterectomy, unilateral ovariectomy, vasectomy, laparoscopic surgery, which they presented as equivalent or preferable alternatives to traditional spay techniques, and little discussion of high-quality, high-volume spay-neuter techniques. And finally, the topic has made the popular press, as you can see here with this recent article in The Atlantic. There's a lot of confusing information out there, and honestly, some misinformation. So let's look at the realities. Routine gonadectomy of companion animals is commonly accepted procedure in the United States. The widespread recommendation for gonadectomy is based on advocating for the welfare of the animal as well as the general canine population by reducing the incidence of certain medical problems and minimizing contributions to the homeless animal population. In addition to these benefits, gonadectomy also has the potential to affect an individual dog's risk of certain diseases and disorders. Although information about the risks associated with gonadectomy has been reported in the past, the recommendations for gonadectomy as a blanket policy is increasingly controversial, with greater focus on possible ramifications for individual animals, in addition to the canine population as a whole. These risks and benefits must be revisited as new information becomes available. Because of the substantial national problem of homeless animals, shelter and rescue organizations are encouraged to spay and neuter dogs prior to adoption to prevent these animals from further contributing to the population of unwanted animals. In unowned or shelter animals, decisions for neutering should be made from the population medicine or kennel perspective. It is typically performed at an early age in both males and females, and most of these animals are adopted and they go on to live a long, healthy life. In these situations, there's a delicate balance between making the best decision for the pet versus the best decision for the prudent use of financial resources for the entire population of animals housed in that facility. However, for owned animals, increasingly, these decisions should be made on an individual case-by-case basis. The American College of Theriogenologists and the Society for Theriogenology believe that companion animals not intended for breeding should be spayed or neutered. However, both organizations believe that the decision to spay or neuter a pet must be made on a case-by-case basis, taking into consideration the pet's age, breed, sex, intended use, household environment, that's going to be important, I'll mention that in a minute, and temperament. Pet overpopulation in the U.S. is a critical issue, with approximately 6 to 8 million cats and dogs entering shelters annually, of which 2.7 to 4 million are euthanized. While shelter deaths have dropped from 12 to 20 million in the late 70s, shelters remain over capacity. particularly with large dogs. In the U.S., dog and cat populations have surged since 1996, and globally, 75 to 80% of dog and cat populations are free roaming. There is a growing access to care and affordability of care crisis, which contributes to increased shelter intake, length of stay, and euthanasia, much of which is directly attributable to decreased spay and neuter and reduced options. So there are many documented health benefits associated with gonadectomy. Only recently, concerns have developed with respect to health risks associated with it. This has caused quite a stir, and many are now questioning the one-size-fits-all recommendation. It is well documented that gonadectomy significantly reduces pyometra, testicular cancer, and mammary tumors in pets. Unspayed female dogs have a high incidence of mammary tumors, with lifetime risk of roughly 23 to 34%, more than 1 in 4. And these account for up to 70% of all tumors in intact females. Pyometra, a serious bacterial uterine infection in unspayed dogs, has a high incidence with approximately 25% of unspayed females developing the condition before the age of 10. The risk increases with age, particularly middle-aged to older dogs with a median age of 9 years, due to repeated estrus cycles. This is a life-threatening emergency condition requiring immediate veterinary care, usually spaying, to prevent sepsis and death. Studies suggest that gonadectomized dogs and cats generally live longer than their intact counterparts, with some data indicating an increase in median lifespan up to 13.8% in males and 26.3% in females. This is attributed to decreased incidence of certain cancers and infections, as well as behavioral changes that reduce injury risks. However, breed and sex differences may influence longevity outcomes. It's important when discussing potential risks to gonadectomy that one differentiate the concept of life-threatening and life-altering. For instance, pyometra in an intact female is life-threatening, whereas urinary incontinence is life-altering and medically manageable. It's equally important to remember that correlation does not equal causation. Just because two things happen together or change in similar patterns, correlation, it does not automatically mean that one causes the other, causation. A third factor, reverse causation, or random chance may be responsible. For instance, sleeping with shoes on is correlated with waking up with a headache. But in this case, the cause is a third factor, going to bed drunk. Another example, ice cream sales and shark attacks are correlated because they both increase in the summer. But buying ice cream does not cause shark attacks. Lastly, experts point out that some of the reported studies may be subject to several biases, notably selection bias, recall bias, and small sample size. And we're going to talk about these a little bit more in just a minute. An important consideration is, are the results reported in one breed generalizable to the dog population as a whole? Studies suggest that gonadectomy may increase the risk of orthopedic conditions like hip dysplasia and cruciate ligament injury due to altered growth patterns in certain breeds. This is the most compelling argument, in my mind, for delaying spay-neuter in purebred large breed dogs. However, it is important to remember that the data reported to date is far from conclusive. While it's worth considering this risk, keep in mind the idea of a life-altering condition, cranial cruciate ligament injury, versus a life-threatening condition such as pyometra. Female animals can experience urinary incontinence after gonadectomy, requiring monitoring and management, and without adjusted caloric intake, gonadectomized animals face increased risk of obesity and related health issues. However, these can be mitigated with dietary management and exercise. So an odds ratio is a statistical measure that compares the likelihood of an event, such as developing a disease, occurring in an exposed group versus a non-exposed or control group. The odds ratio is a measure of the strength of association between an exposure, in this case being spayed, and an event. And here we're talking about mast cell tumor. In this case, since we're studying the link between being spayed, the exposure, and developing mast cell tumor, the outcome, an odds ratio of 4.11 means individuals who have been spayed have 4.11 times the odds of developing the disease compared to those who have not. However, one must consider the importance of breed predilection. In a low-incidence situation, odds ratio is a good approximation of incidence. Considering mast cell tumor with a baseline prevalence of 1%, one dog in 100, an odds ratio of 4.11 would predict an expected incidence of 4%, 4 dogs in 100. The bottom line is that overall, the incidence of these types of cancer is low, and there is a strong breed predilection. Several other types of cancer, notably lymphoma and hemangiosarcoma, there is a strong breed predilection. And more importantly, the overall incidence is low. There was an article published by a fellow by the name of Scott Bailey entitled Neoplastic Conditions Associated with Spay-Neuter Status in the Canine, published in the Journal of Clinical Theriogenology back in 2016. He states, the complicated relationship between gender, gonadal status, breed, and tumor risk need to be addressed through proactive conversations between owners and veterinarians. Unquote. The primary factors that should be accounted for when deciding if and when to perform a spay-neuter procedure are the owner's willingness to accommodate for normal reproductive physiology and behavior, and the owner's ability to prevent unwanted breedings. Brothers and sisters wouldn't do that, right? Remember that thought. I'm going to tell you a story here in a minute. You know, the breed of the dog, breed predisposition to develop specific tumor types or other complications, and the relative morbidity and mortality associated with specific tumor types. Here's a nice tabular view from this same article of the common malignancies and their relationship with spay-neuter. And I want to highlight the risk of mammary tumor is significantly reduced by spay-neuter. The others listed show a 1.3 to 9-fold increase as a result of spay-neuter. My friend and colleague, Dr. Phil Bushby, has been famously quoted as saying, doubling a small incidence gives you a small incidence. Keep that in mind. You're going to hear that again. This leads us to a discussion of the factors influencing the optimal age for gonadectomy. The first factor to consider is whether we're referring to shelter animals or own pets. Shelters often perform early age gonadectomy, as early as 6 to 8 weeks of age, to ensure pets are sterilized before adoption, which reduces shelter overpopulation, reduces shelter length of stay. In contrast, own pets may have a more individualized assessment, allowing surgery at older stages with full health screenings. So things like resource limitations, population control urgencies, and owner preferences influence the timing of these different contexts. For own pets, considerations include breed and size impacts as well as genetic predisposition. Behavioral impacts, such as decreased marking, roaming, and aggression, are often cited as reasons for gonadectomy, especially in males. However, some evidence suggests that delaying gonadectomy may allow better behavioral development. Decision-making must balance behavior modification goals with health outcomes, including the risk of anxiety or fearfulness. The bottom line is, there is so much that we do not know about the relationship between gonadectomy and behavior. So we're going to talk a little bit about review of the clinical studies here. Remember our discussion of correlation versus causation. More Americans are doing yoga. More Americans are diabetic. Does yoga cause diabetes? It's important to remember that all conditions are multifactorial. Things like age, breed, body weight, conformation, and environment. And there are potential biases to consider. For instance, most of these studies were done in purebred dogs. The incidence of many diseases increases in purebred dogs. Results are not generalizable to the dog population as a whole. Another potential bias is that most studies were conducted at tertiary care centers and may not be representative of the average dog or owner, which may skew the disease data. All right, let's get cats out of the way right now. One of the more common arguments I hear against early age castration of cats is the theory that castrating male cats prior to sexual maturity makes the penis smaller and predisposes to urinary tract obstruction. Unfortunately, the font's kind of small, but I highlighted it in red. That theory has been proven to be false. Yet I still hear older veterinarians say that. I learned that when I was in veterinary school. You know, that was 40-some years ago. But in a 1996 study, my friend and colleague Peggy Root and as her colleagues Shirley and Gary Johnston demonstrated there was no difference in urethral diameters between cats castrated at 7 weeks, cats castrated at 7 months, or intact cats. Another that you may hear is the occurrence of epiphyseal fractures, so-called slip capital femoral epiphysis, or SCFE, in gonadectomized cats. Prospective studies of prepubertal, before puberty, gonadectomy do not support the contention that SCFE is a frequent occurrence. No instances occurred among 417 prepubertally gonadectomized cats in a long-term follow-up. Similarly, other studies of prepubertally altered cats noted no difference in fractures or other musculoskeletal problems between young age-altered cats and those undergoing traditional age surgery at 6 months or older. So we can get cats out of the way right away. For female cats, since they come into heat by 4.5 to 5 months of age, sterilized by 5 months of age. Hence, you're going to see it all over this, this conference, the Feline Fix by 5 initiative. No reason not to, both males and females. For dogs, the situation is a little murkier. The good news is that sterilization is strongly associated with an increase in lifespan. And while it decreased the risk of death from certain other causes, such as infectious disease, it actually increased the risk of death from others, such as certain types of cancer. We know that sterilization is associated with increased longevity and increased life expectancy, which is increased by 13.8% in males and 26.3% in females. For dogs, early castration in male dogs offers more benefits than risks. Males in shelters should be castrated at an early age. Owned dogs should be castrated prior to the more traditional 6 to 8 months of age. In females, because of the potential risk of urinary incontinence, it is recommended that ovarian hysterectomy should be delayed until 3 months of age. Although this is a life-altering condition, not a life-threatening one, that would increase the dog's length of stay in the shelter and thereby possibly exposing her to increased risk of infectious disease or behavioral deterioration. Because of the substantial national problem of homeless animals, shelter and rescue organizations are encouraged to spay and neuter dogs prior to adoption to prevent those animals from further contributing to the population of unwanted animals. So she just held up the 5-minute sign, so I may have to speed up a little bit. Now, was that 5 minutes before the... Oh, I got 20 minutes, okay. I want to leave some time for Q&A, but so, all right, we're going to skip that. That's, all right, so for owned animals, studies suggest customizing spay-neuter timing to individual animal risk profiles for optimal health concerns. Guidelines recommend surgery between 6 to 9 months, but recognize that surgery is important for population control. And there are gaps in the research. Meta-analyses reveal limited data on long-term orthopedic and behavioral effects, suggesting cautious decision-making. And remember our earlier discussion. Correlation does not equal causation. Just because two things happen together or change in similar patterns, it doesn't automatically mean that one causes the other. A third factor, reverse causation or random chance, could be responsible. And it's important to consider the concept of relative risk. As Dr. Bushby has been famously quoted, doubling a low incidence gives you a low incidence. And keep in mind that many of the studies are subject to biases, notably selection bias, recall bias, and small sample sizes. Early age gonadectomy has potential benefits and potential risks. It effectively reduces animal population, but might increase musculoskeletal risks in certain breeds of dogs. Delayed gonadectomy may have some advantage, but also some challenges. Delaying surgery helps lower orthopedic risks in certain breeds of dogs, but may cause unintended litters and behavioral issues. Also, remember, the risk of mammary neoplasia increases with each estrus cycle. Be cognizant of species and breed variation. It is important to remember the role of breed predisposition. Outcomes vary by species, breed, and study design, requiring tailored veterinary decisions for owned animals. A thorough review of the literature reveals some expert consensus and areas of ongoing debate. Experts agree that the benefits of gonadectomy generally outweigh the risks for most dogs across breeds and sizes. Ongoing debate focuses on optimal timing of gonadectomy for large breeds due to potential health concerns. Concerns about cancers and orthopedic diseases highlight the need for continued research to establish best practices. Best practice includes assessing each dog's breed, lifestyle, and owner goals to tailor these decisions. So how can we use all this in our decision-making process? So the question that I'm often asked is it still okay to spay? For individual animals, we've already established the health benefits outweigh the detriments. And keep in mind the concept of life-altering versus life-threatening. Think about reasons for surrender and abandonment. For population management, unwanted, unplanned litters. You know, brothers and sisters wouldn't do that, would they? A friend of mine, this is a true story, bought 2 cane corsos, male and female, and from the same litter, Her vet told her not to spay the female until she'd had a heat cycle because she's a large breed dog. Well, guess what? She came in heat. Got bred by her brother. She is really no longer a friend of mine because she's not very smart. But it happens. And there are other considerations, free roaming population, shelter intake, adoption capacity, public health and safety. The other thing that really concerns me is I'm told of chatter on some of the animal welfare discussion boards saying that, quote, shelters and shelter veterinarians are harming our pets, unquote, by promoting pediatric sterilization. Remember, the overarching goal of sterilization is to prevent unwanted animals. Sterilization of animals prior to adoption, regardless of age, gets animals adopted faster, reduces length of stay, and reduces euthanasia. Despite the suggestion that in some breeds early sterilization increases the small incidence of certain conditions, it is still in the animal's best interest. When all factors are considered, sterilization is associated with a significant increase in life expectancy in dogs and cats, male and female. So the answer, in my humble opinion, is yes. So we've reached the point of what I call the world according to Bob. After studying the research, my personal recommendations are, for shelter animals, because animal population control is the overarching concern, sterilize prior to adoption regardless of age. Sterilization is associated with increases in adoptions, reductions in shelter intake, and reductions in shelter euthanasia. For owned animals, it is important to develop a relationship with a competent veterinarian to advise owners on responsible pet ownership. For instance, if the owner wishes to spay a large breed female dog after her first heat, it will be important to keep any male dogs from having access to her while she is in heat. Remember the story of my ex-friend. In the instance of a large breed dog, moderation of exercise and weight management can help prevent cruciate ligament injuries. So for owned animals, after studying the literature, I recommend female dogs spay prior to their first heat cycle, because that significantly reduces the risk of mammary neoplasia. Male dogs, castrate prior to sexual maturity. Again, by 6 months of age in most cases. Remember what I just said. In the instance of an owned large breed dog, moderation of exercise and weight management can help prevent cruciate ligament injuries. This is why the aforementioned relationship with a competent veterinarian is so important. Just because of a reported increase in, say, cruciate ligament injuries in one breed of dog does not mean that it is generalizable to all breeds of dogs, including mixed breeds. And remember, sterilization was strongly associated with an increase in lifespan. When all factors are considered, sterilization is associated with a significant increase in life expectancy in dogs and cats, male and female. Animals housed in humane societies should be treated as a population. Societal benefit resulting from gonadectomy of unowned dogs and cats in the United States outweighs all other concerns. Male and female dogs and cats should be spayed or castrated before being offered for adoption by humane organizations. Remember Dr. Bushby's sage advice. Doubling a low incidence gives you a low incidence. Think of the incidence of mammary tumor compared to lymphoma in spayed versus unspayed females. Remember that correlation does not mean causation, and don't lose sight of the fact of the difference between life-altering and life-threatening. Think of the incidence of pyometra. So there's a lot A lot of confusion and controversy surrounding the optimal age to spay and neuter. We need long-term impact studies, research focusing on orthopedic health, cancer risk, and behavioral outcomes in diverse animal breeds. Continued development of minimally invasive techniques. Advances in surgical and anesthesia methods lead to safer procedures and faster recovery. We need to continue work in the area of non-surgical contraceptives and sterilants. Contraception without the need for anesthesia and surgery. Imagine how much more efficient that would be. We know that many of the potential adverse outcomes are related to breed and genetic predisposition. So genetic profiling would be beneficial. Personalized medicine approaches using genetic profiling refine surgery timing and improve outcomes. So this presentation has highlighted the complex considerations for owned animals in determining the best age for gonadectomy in dogs and cats, including health benefits, risks, and behavioral factors. Remember, correlation does not equal causation. Emphasizing evidence-based guidelines alongside individual animal and owner circumstances is key. However, be mindful of potential biases in studies. And veterinarians play a crucial role in communicating these factors to ensure informed decisions that promote long-term health and welfare. Remember that doubling a small incidence still gives you a small incidence. So you remember our original question? Why do we sterilize animals? The most common answers are they're healthier. I submit that when you look at all the data, they are. They have a longer lifespan, for one thing. They behave better. The data is conflicting here, but consider this. We castrate bulls, stallions, and tomcats because to not do so makes them difficult, if not impossible, to live with. But I would argue that we sterilize animals to prevent reproduction. I submit that the overarching reason we sterilize animals is to prevent reproduction. And until newer, safer methods emerge, think non-surgical sterilization here may preserve some normal hormonal function, I believe we should continue to do so. So here's my citation list. If anybody wants to look at the citations that I cited in this presentation. And I'd like to finish my, my presentations with what I call my words of wisdom. And Mahatma Gandhi once said, the greatness of a nation and its moral progress can be judged by the way its animals are treated. Killing millions of unwanted animals in shelters does not, in my mind, count as moral progress. We make our decisions on what is best for all animals. I submit that promoting sterilization is in their best interest, but you have to make up your own mind. Remember, I told you earlier on that I'm not here to tell you what to think. I just want you to think about this issue. Thank you very much. Now we'll take some questions. All right. Oh, I see a hand up already.
Thank you, Dr. Weedon. So I don't have a question about timing, but I have always been confused by ovariectomy. I don't understand why that would be chosen and done over the ovary sparing or, yeah.
All right, so the question is, why would a veterinarian choose ovariectomy over ovariohysterectomy? Hey, Heather, you made it. The veterinarians that perform ovariectomies believe that it is a quicker procedure and the incision is smaller because you're only removing the ovaries, you're not removing the whole uterus. In my hands, it actually is a more difficult procedure because you have to tie off 4 blood vessels the blood supply to the ovary on both sides, and then the blood supply from the uterus to the ovary on both sides. So that's 4 ligatures rather than 3. And my incisions are typically pretty small, and you know, there's concern, well, if you leave uterus, they're at risk for pyometra. That's not true. Pyometra is not a disease of the uterus. It's a hormonal disease. If you get all the ovary, you're not gonna have pyometra. So if I, with a small incision, if I got a large dog, if I leave a little more uterus, that's okay, as long as I get all the ovary. And that's the argument for doing ovariectomy is that, well, we're taking the ovaries out, but they're not going to develop pyometra. So it becomes a personal preference thing. I've been doing ovariohysterectomy for decades, and that's what I'm comfortable with. But other veterinarians choose to just do ovariectomies. Now, what boggles my mind is I've got a really good friend and colleague who has decided to start leaving one ovary in golden retrievers because of their potential risk for cancer. And I'm like, but Kevin, you know, they're going to go through heat cycles, and she's going to be at risk for, you know, mammary tumors. And his response is, yeah, but I can remove those surgically, no big deal. You know, if she develops hemangiosarcoma, then you're talking about chemo and you know, shortened life expectancy. That's his decision. I don't agree with it, but, you know, and time will tell if that's necessarily the right thing to do. So, another question. I figured we'd have tons of questions, being this is a controversial issue, but.
My question is for humane societies that are in areas that rely on your local full-service vets to do the spays and neuters. There are not a lot of high-volume clinics, as you've heard at this conference. So how are those folks convincing their full-service veterinarians who are doing the work for the humane societies to do pediatric spay-neuter? And is there an article that can help us to share with them?
So how do you, as a shelter or rescue organization, convince a private practitioner to do pediatric sterilization? I mean, you can look at my my list of citations. There's a number of good resources out there promoting pediatric sterilization. For me, the one I cited early on, that there's a 2% increase in complication rate for each additional minute of anesthesia. You know, it takes me single-digit minutes to spay a pediatric female, whereas it might take me 10 minutes to spay a larger female. And consider this, you know, some rescues have found that, okay, their veterinarian refuses to sterilize them until they're older. And then they get big, and then the veterinarian refuses to sterilize them because they don't spay anything over 50 pounds. That's a conundrum that I'm hearing more and more about, and it's potentially an issue. So, so she held up the 3-minute sign. Anybody else have any questions? Over here in the corner.
Couple thoughts. Am I speaking? Okay, hello. Okay, what were my questions? So spaying females, I'm mostly cats, but spaying females while they're in heat, we are a rescue, we use private vets, we don't have a vet, or we don't have anybody on staff for that matter. So spaying females while they're in heat, and then also spaying females who have nursed recently. So like when the kittens are 6 to 8 weeks old, we're having some issues with vets with that.
So the question is, I'm down to 1 minute. I have to talk fast. Spaying females in heat, we do it all the time. There is reportedly some increase in complications in terms of particularly dogs that develop some people call it a stump pyometra. It's really a stump granuloma, just inflammation associated with the suture of the ligature. We do it all the time. And same with spaying pregnant animals, you know. People call them spay aborts. I don't like that term. I like the term gravid pregnancy. And I'm not going to get into the philosophy on that because we're A, out of time, and B, I don't want to get in an argument, but I figure there are enough kittens in the world. But spaying cats that are in heat or that are lactating, it's actually very easy to do if you stay on the midline. A lot of people advocate for flank spays. Dr. Bushby, for instance, says all feral cats should be sterilized with a flank spay because if the incision dehisces, guts aren't going to fall out. That rarely happens, but flank spays, you don't have to avoid the milk-producing stuff. Okay, I'm sure I'm out of time now, and I don't want to run over. So thank you all very much.
Thank you so much to Dr. Weedon. So we have a 10-minute break now. There's a snack, and we believe that it's located in the main room. So head over there, get you a snack, and head back over here.